welcome everyone. It is 9:06. I apologize for us being a few minutes late this morning. It is January 16th, 2024. Please let the record reflect that all 5 commissioners are present and our executive management team. We are going to go ahead and get started with Mike Burgess. Mike, as you get started, I'm going to just let the commissioners know I am actually driving over for the GSI fly-in, and with the pass, the snow's hitting the pass around 4 o'clock. I think I was initially going to leave after the 2 o'clock, so I think I will be leaving when this meeting is over today to get started. And so, Commissioner Kearns, I'll probably, since I'll be from the car, have you go ahead and lead the meeting if that's okay.
That's fine. Yep.
Okay. Very good. Thank you. And then I will see you all in Olympia tomorrow. No, you're not going to be at the plant.
No.
Okay. Everyone else will be tomorrow.
Yep.
Okay. Awesome.
Weather permit.
Yes. It could be the planes could be an issue tomorrow as well.
Yeah.
Seattle's where they can't deal
Yeah,
with the
they can't do
What
it.
Alaska flight are you on?
So,
Don't sit next to the door.
aisle seats.
so with that, Mike, I will go ahead and you get to tell us all about what we're going to be experiencing when we get there.
All right. Looking at the weather here, it's supposed to snow here overnight, but it's going to be like in the high 30s tomorrow, so we'll be okay here. So bring some rain boots. Real quickly, just wanted to run through this bill list. I have a hard out here at like 9:30, 9:35. So this is my best attempt to reflect the priorities that were in your legislative agenda. You'll notice the positions will say neutral and in one case opposed. That's just because I haven't changed the position yet because we haven't spoken as a group. I'm almost certain I know what your positions will be on these bills, but in fairness to you all in your process, didn't want to jump the gun on that. The first 2 there are dealing with the wildfire response. From a status update, nothing has happened with 1899. That's what I would call the building code one. You remember that's the bill that would let you build back retroactively with the building code that was in place when you built your home. That has not moved or even had a hearing scheduled. We will see the schedule for next week tomorrow night. So while you're over here, we'll see it, and I'll let you know what's on it at that point. 1952 deals with the disaster concerning long-term community recovery disasters. This is where the military department would get involved in the responses. It's a Vols bill. It did have a hearing last week and a committee vote yesterday, so that bill's moving its way through the process. Do you have any questions about either of those 2, given that they're a similar subject matter? Okay, I'll keep going. Sorry.
Mike, I understand and have written a letter in support of a funding request from Medical Lake for about $63 million for sewer and water extensions around Silver Lake and that area out there and stuff. Are you familiar with that?
No, Commissioner, if you want to share that letter with me, that'd be great. And then have they submitted a budget request form for that? And if they haven't, they should.
Evidently, Representative Graham is the one that's heading up that effort, but
Okay.
I know that she's working with other legislators and stuff. So we're going to be talking about it a little bit later on this morning. But anyway, I just wanted to put that on your radar.
Gotcha. Okay. Thank you. The next one, 2137, we have not talked about. It's kind of a housekeeping bill that deals with your tourism and marketing funds. Some jurisdictions, and if I don't say this properly, please correct me, but some jurisdictions had been granting exemptions that the law didn't allow. This bill is to clean that up. It's not controversial bill. It had its hearing last week and is going to get voted from committee on Friday. But your jurisdiction is one of those that was granting some exemptions, and it's not that you did anything wrong. It's just that the Department of Revenue interpreted the law in such a way that you weren't technically allowed to do the exemption. So this just, in my mind, this probably cleans up your current practice in the county. Would be my best guess on that. The next one, oh, and I guess I should ask commissioners, I assume with those first three, you're fine with being in support of all three of those? Is that okay, or do you need to take them one by one in your own process?
I'm fine with all three of them.
I'm okay with them. I think you have multiple head nods, so.
Okay, great. The next one deals with the 911 funds. I've talked to a few of you about this. This is another, remember the Riccelli bill a few years ago that would have said that the county and city had to get together. I've been given some of the backstory on the information of what happened with those. I don't know if it's negotiations. But this is another attempt at that issue. Not exactly the same way. But essentially it would take the 911 funds that are generated in the city and go to the city. You might remember that Representative Ormsby mentioned this when you all were together when we had them in for the legislative kind of agenda briefing. The bill's being heard today. There's several entities from Spokane testifying against it, your sheriff being one of them. And I don't know if you want to make some comments on that. My assumption is this is a bill that you as a board would oppose, but wanted to get your direction on that.
Scott, do you want to?
Yeah, I can give a little bit of overview. So we have about $5 million in 911 excise tax that comes through the county. Well, it comes through the state 911, gets disseminated to the county, which the county then forwards it on to SHREC. And the 911 excise tax goes to pay for essentially the 911 system, which as it stands today is managed wholly by SHREC. It's our regional combined emergency communications system for 20 of the 21 jurisdictions who use that. The only one that doesn't is Spokane Police Department as far as dispatching goes. So that goes to pay for our call receivers who receive the initial 911 call, as well as invest in the phone system and all of the related component equipment, replacing it, upgrading it, purchasing it, etc. So right now, if this bill goes through as it is, about 2.5 million would end up going to the city of Spokane versus coming to SHREC, which creates a whole litany of questions, issues with regards to how to pay for 911, what's the impact on timing of call receiving if now SHREC has 2.5 million less in funds coming in. What is the impact on SHREC continuing to be the PSAP versus kicking into the city of Spokane and them being a PSAP? It's just, there's a lot of complexities, and it just, again, moves away from what a state and national best practice shows on integrated systems that reduce call times, increase dispatch times, increase the ability to dispatch more quickly. So we had a long conversation yesterday with the SHREC board, part of the SHREC board, and I know Cody Rohrbach's Fire District 3 chief has signed up to testify. I believe Dave Ellis is testifying in sheriff's place. There's probably 2 or 3 other public safety jurisdictions between fire and others who are signed up to testify against it as well today. That's at 10:30.
It is, Scott. And then I'd just add, the bill 2 or 3 years ago was drafted that it was Spokane County only. This bill is not that way. This bill is broader. It would involve every county in the state. And I've heard from some of my colleagues that it's certainly problematic for individual counties, just for some more backstory there. But it will certainly be looped into, just given the nature of who's testifying on the bill, that this is a Spokane issue. And I think committee members will remember that bill from a few years ago.
Commissioner French.
So I seem to remember, but correct me if my memory is incorrect here. When we were struggling with trying to deal with what the city was trying to do with regard to taking funds away from SHREC, one of the possible solutions was discontinuing crime check inside the city limits. and for some reason I remember that, but I don't know that my memory is pure as far as that as an option. Is that possible, one of the options to be able to make up for the revenue loss, or is the system developed to the point to where there really is no savings by eliminating crime check?
Well, that's an interesting question and a complex one. The emergency communication tax itself pays for crime check.
Right.
So one assumption could be that if the city took, and they still have not opted to take their apportionment of the emergency communication sales tax. If the city took it, they could continue to contract with Shrek to receive crime check calls. Alternatively, I guess the city could set up their own crime check phone number and receive those calls, which would take it off of Shrek. There's no cost savings in this stuff. It's actually what was demonstrated to the city is it'll cost you more to receive the apportionment and get a bill back from Shrek for the services.
Yeah.
Yeah.
Okay, thank you.
Commissioner Waldron.
I need to get caught up on some of the details on this, so I probably need some more information, but what is the barrier to Spokane Police Department being part of the dispatch system? Is it something to do with they like their CAD system better than what's used at Shrek? Or
No, the CAD systems are the same.
same CAD system?
It's really a
Okay.
choice. They don't want to give up the dispatching, from what I understand. They want to keep the dispatching with their employees
Union,
at
it's
City of Spokane.
a union thing.
I just remember from the very early conversations that they were never going to join. The fire department was the football that was going back and forth, and they eventually did join the Shrek system. Was there ever, has there been efforts to bring them into the fold, or?
When we were having the discussions, when I first became commissioner, as we were looking to form Shrek, everybody was gonna come to the table. I mean,
Yeah.
the fire chief was here, the police chief was here. We had a couple of fire chiefs in the valley that had been in regional systems, and we're just like, this needs to happen, and I think it'd been talked about for years prior. So at that point in time, everybody was at the table. There was discussions on.
Yeah, I guess I was surprised. I thought it was just the fire department that never joined, but then it was the police department.
Yeah, fire joined, SPD is not. I have not talked with them directly, but my understanding is they don't want to. They're the only Cheney Police is another jurisdiction, but they're actually working on joining right now. So SPD is the only law enforcement. They're the only agency
How are
that's
the
not joined.
911 funds, how are they collected? Where do they come from the state down to the local?
There's a
I just have a lot of
charge,
questions, and I don't wanna
yeah.
take up all the time, but I think I need to dig into it a little bit more to understand how the money's collected, how it's distributed.
Yeah, I'd be happy to spend some time with you on giving you some more of the background.
Does it just come out of state funds?
No, it's tax
Local
dollars,
Sales tax.
because part of it's a local sales tax.
No, I'm talking about
The emergency communications is sales tax,
Yeah, I'm
911 is a
familiar with that.
charge assessed on landlines and mobile lines.
On phones.
I think it's like 25 cents a line, and then there's also a pro rata distribution. State keeps some, they distribute some to the counties.
So I can see where if you're paying this charge, where does it go and what benefit do you get back from it, right?
So except everybody, when you dial 911,
Right.
goes to the regional system, and then they dispatch it to the fire department, or to the police department from there. So you still have it all going into the regional system, because it has to go to one place. And then go, so that's
So,
where
yeah, I kinda
there'd be
wonder-
this charging back and
Yeah.
forth that isn't happening now. That when we looked at it 2 years ago, it was gonna cost the city more money than what it's currently, because they're not charging them. They're just doing it for them. So as part of the system, so I think you're probably, I know you guys probably have more questions, but you're looking to see, since it's today, if 3 of us are willing to sign in as opposed. Have you signed as opposed? Three or more.
So,
Mike?
okay, so I will sign us in opposed.
Yeah, I mean, because it's still, we've got to do it as a system.
Yeah,
Okay, I will get you signed in opposed, and like I said, there's testimony coming from folks in uniform, so. The next bill on the list is a holdover from last year that deals with the prejudgment interest. This is a fiscal issue for you all. I don't know why, but my bill tracking system is displaying that bill is dead. It is not dead. It is getting a hearing, or it was heard yesterday afternoon in the Ways and Means Committee. So I just wanted to maintain that because again, we had the position of opposition on that bill last year. The next bill, 5792, is the newest version of the condo bill, waiting for a hearing on that one. And then the second to last bill, 5834, the urban growth areas, that is what we've been talking about as the land swap bill. That bill had a hearing early last week, but Scott from your staff pointed out that there's some drafting problems with it, and it has to do with the definition of aquifer area that's in the bill, and I'm oversimplifying that. But I've given that language to folks with the city of Cheney, who's kind of were the ones that brought the bill forward, and they agreed that there is a language problem. So we're working through that process here. Yeah, sorry.
Commissioner Jordan had a comment.
Just a quick backing up to 5792, we put in our agenda being in favor of expanding housing options as it relates to condos. So should we be in favor of this bill?
Yeah, so you're right, Commissioner. Sorry, I jumped over that. So yes, I would move your position to support, given that's what the will of the board.
Yes,
Thank you.
thank you.
Okay, thank you for clarifying that. And then same with, I guess it'd be the same with 5834. I'm supporting the bill as long as the amendment language that's suggested by staff gets us where we need to be. Or is that something where, as a board, you feel like you need to see what that amendment language is to better understand what he's asking?
I think, Madam Chair, wasn't it something to do with critical aquifer recharge areas, which is, but the way it was broadly defined, it would be like the entire county or the entire, a huge portion of the county, so that it would kind of make it irrelevant to allow for the land swaps then, right? Okay.
You are 100% right, Commissioner. That's what it does. So,
So I see all the head nods that were in support.
okay. And then the last bill, that is just the Senate version of that tourism tax exemption bill that I mentioned earlier, 2137. The bill tracker just will list them both. So I'll move all those to, I'll move everything to support, but for the 911 bill, and then that prejudgment interest would stay as opposed, as we had last year. I wanted to get moving on the bill list because I was worried about time, but just kind of generally where we're at, we're day 9 of the session, in kind of the grind of committee hearings, pretty normal process. What's interesting though is the legislature can pre-file bills, and there were over 700 pre-files this year, which is a huge amount considering that last year there were about 2,300 bills total introduced. You just do the math there, it's almost a third of the volume from last year was pre-filed for introduction this year, which has the impact of really siphoning down anything that's being introduced right now, even receiving consideration. Because, if you're doing your job as a legislator, you're working your bill introductions and setting up hearings with the prime sponsor or with the committee chairs. So just kind of an interesting thing that's different than I've ever seen from previous sessions. There's always pre-files, but never the volume of this. Our first cutoff is at the end of January, early February. So that's when things will really siphon down. And a lot of the bills that you might be hearing about through other channels will have either continued in the process or will no longer be considered. So we'll continue to whittle that down. I will keep adding to this bill tracker. I will keep sending you a report on this week. I think I sent it Saturday mornings. I'll try to send them Fridays, but for sure over the weekend you'll see it. And then we'll discuss those bills on Tuesdays. This is more for Jeff, but he loves this part of the process. I have those budget forms, Jeff, available, and I will get them to you. These are your capital budget request forms for the projects that are on our list. Interestingly, I know the Senate, I have to verify on the House, but the Senate is not taking transportation budget request forms simply because of the lack of funds to fund new projects. A lot of that probably having to do with the salmon culvert issue. Last thing on my end, if one of you or somebody there, staff, could send me the GSI schedule. I don't have it yet, because I certainly want to interact and see you all when you're here. I have, lots of calendar things going on, but we'll definitely make a point to come to any of the GSI events. I'm actually pretty wide open tomorrow that I look at it, so. Anyway.
Jeff Morris will send you that.
Perfect.
So,
I don't know if you have any other questions for me, commissioners. If you hear of things, please call me or text me or email, whichever, about other bills. If I missed one, it's entirely possible. I'm trying to really just focus on the ones that are getting hearings and moving now, just given the volume, so.
So Mike, one of the things I heard from the local legislators were that they had to pre-file, that they were being told that they needed to pre-file everything, with it being a short session, that
Yeah.
they really weren't gonna do much if it wasn't pre-filed, so.
Correct.
I knew some of them had like a December cutoff that they had to get
Yes.
bills.
And, sometimes, Commissioner, that's kind of a do as I say, not as I do type thing, right? Because if a bill needs to, if someone has the will to get a bill passed and the chair wants to do it, they'll do it. But you're right. I mean, it's a drastic difference. So it doesn't surprise me that you'd heard that.
Okay, any other questions for Mike? It looks like most of us will see you over there tomorrow.
Okay, very good. Travel safe. Talk to you soon.
Thank you. Okay, it's gonna keep us right on time then. Justin.
Good morning, Commissioners.
Good morning.
We have a packed agenda here. We're going to be bringing forward all of the work we've been doing on the opiate settlement funds and the OAC. Before we jump into that, just a quick update on our BHAB. This is a cleanup administratively. When our name changed from Community Services, Housing and Community Development Department to Community Services, we have been changing over the last year to reflect that updated name. It just happens that we came to the BHAB at the start of this year, and because this is a bylaw to an advisory board that advises the board requires any changes go through the board for consent. And so we're just bringing forward this. The only change in the bylaws for the BHAB will be the name from CSHCD to CSD. And we just want to make you aware of that. You'll be seeing that next week on the consent agenda. But no other changes are expected, nor is there any indication of that. I believe the board had already approved major updates last year. So that is the only update on BHAB. Questions? All right, now we're jumping into the topic du jour. So at the direction of the board, we have been working on various opiate abatement projects. The Opiate Abatement Council, at the work that Scott and the team has done previously to help set that up. We've been working on facilitating those meetings with the participating local governments. And then we are also been working on the opiate settlement dollars that have been distributed to the county specific, Spokane County, and looking at priorities that the direction the board had requested we provide, looking at what are the gaps and needs and getting public comment. So I want to be clear, those are the two issues. They are similar in the sense that they both address opiate settlement funds, but they are distinct and separate because the facilitation or the work therein with the participating local governments is separate, does not have direct control or oversight over the county funds. Of course, that defers to the Board of County Commissioners. So when we talk about the priorities and the work on that, it'll be specific and separate to what the work we're doing on the OAC. Kind of a timeline here, the OAC and the work done with the participating local governments occurred earlier this year during the May and July period. A lot of work with Scott and the team and the attorneys to get back and forth with participating local governments. As of December, all have signed and are on board, so that part's great. We started meetings in November and have been meeting monthly, and the cadence has been a monthly turnaround, so we'll give you an update on what that's been looking like. And then we also have a website, so we've met all the administrative requirements. And then the timeline around for the opiate priorities for Spokane County's dollars was direction of the board in September of last year. We opened this up for public survey and response, and then we met afterwards to collate the information. That really was the end of November into December, and of course, that took some time, and then with the holiday, this is why we're bringing it forward now. So that's sort of the timeline of why we're meeting today to bring it forward, and really looking at the board's direction on next steps. So jumping into the updates, I actually have one of my staff here who's been facilitating a lot of work on this. She'll be providing a lot of the updates in the work as to kind of what has been going on. Jessica Thompson is an integrated care coordinator and program administrator with our department, and she's been working very diligently. I'll turn it over to her.
Thank you, Justin. And can we have the next slide, please? And the next one, sorry, we're a little behind. Next one, please. Wonderful. And then one more time, so as Justin shared, we are going to go over first an update on the Opioid Abatement Council. That lasted a while last time, so I'm gonna pause. So as Justin previously shared, we had our first Opioid Abatement Council meeting held on October 30th. It went very well. We did introductions, discussed the roles and responsibilities of the Opioid Abatement Council, and did have good representation at that. Since then, we've had 2 additional meetings. As Justin shared, we've been meeting on a monthly basis as we get started, and we might move that to quarterly as we move forward. We have our website up and running, so the OAC website's up and running. And that can all be shared out with you so you can review that. We are awaiting the 2023 annual expenditure report so we can upload those onto the website from each participating local government. In addition, we are currently creating a process to receive 5% administrative costs as we are doing the bulk of the work with the website, facilitating the meetings and leading the meetings.
What's the website? Where would people find it if they were going to look?
Yeah, it's on our Community Services Department one. I forget the URL off the top of my head, but it's Spokane Community Services /Opioid Abatement Council.
Thank you.
OAC.
Any other questions or anything you'd like to add, Justin, on the Opioid Abatement Council before we move on to the Spokane County specific opioid settlement funds?
Yes, one of the major things we've been working out with the precinct level governments is process. Of course, getting everyone together and discussing what that looks like when you're having the administrative requirements but no direct authority has been one I think that's been exciting for us to be able to work with those local governments. We did agree to an administrative cost. Again, we've been carrying the cost as part of the Spokane County for a while, so not been paid out for the last 10 months. We do believe we'll close that out this year with sending them an invoice for our staff's time and involvement. And then as we move into 2024, we'll be looking at what that cost looks like specific to the administrative work. And really, it's going to be actuals. We're going to try to say, if that's what the cost is, we'll try to incur only that. We want to get out of the way of taking any additional costs and having to repay that back and letting participating local governments really push that money out to opiate treatment services and or opiate abatement. So that's one of the key areas that we've been working on. There have been some feedback that as they work through it, they would like to hear more about what Spokane County is doing. So that's been the number one question is, what are you guys doing and can we see your results? We said we need to present to the board first before we make it public, and that's something that is now available because of the briefing we're doing here. Then we'll go over what that looks like in terms of the settlement survey results and the public comment.
As I look at the list of the OAC members, is Stevens not a part of it? I thought they were.
Stevens.
Because I know that they were sort of the last, we're waiting on them to sign.
Yes.
Are they?
They signed as of December, and they are now listed. We held off on putting a representative because they had not voted yet on who they wanted.
Okay.
I believe they chose last week, Terrence Robbins, which is part of their Tri-County Health.
Okay.
And Madam Chair, I was just gonna, so it sounds like you're gonna talk about this a little bit when you're talking about the actual types of projects that could be funded or programs. But has there been discussion, I know you've only had a couple meetings, but like if Spokane County were to focus some dollars in a certain area, could other jurisdictions come together around like an RFP process so they could add their dollars if they decide that they too want to invest in a particular program or focus area? Is that how you're seeing it come together? Because it's just a lot of, especially some of these smaller counties, they're not going to have a lot of funds to put out there. So it'd probably behoove them to, if they agree with, putting out an RFP for a certain type of services to just join with the county. So I was just wondering if those were conversations happening so far.
Yes, so we've had extensive conversations. Again, most of the participating local governments within Spokane County are wanting to know what Spokane County is going to do. And I think that's more of a discussion on what the board would like to use with the funds, because separate agreements would have to be in place on how that money is shared and how it's awarded, and then who that entity would be receiving, both theirs and ours, and would be proportionate, right? So if, for example, one of them only gets $5,000 a year and we have a certain amount, we're paying 99% of it, how does that look and who has authority for administrative oversight? I think that's a discussion for the board to determine if they would like to in that process, but it is something I think they would like to participate with us for those participating local governments in Spokane County.
Smaller.
Yeah. For the counties external, the rural counties that are part of our RSA, they've pretty much determined they are going to use it internally for other projects they're doing to abate opiate within their counties. A lot of Narcan, it sounds like.
Right.
With their first responders and or local hospitals. But again, there hasn't been any direct statement of what they want to do yet. They keep asking about what we are going to do.
But with the state settlement and like expectations, like a city like Liberty Lake, they could choose to just, are they allowed to choose to take their dollars and put it with another jurisdiction's dollars, or do they have to do everything separately?
No.
Okay.
It's discretion of the jurisdiction
Okay.
whose dollars they're allocated to, so.
Got it. Okay.
We were deliberate on the front of this thing to say, we're generally open to, if you want to put your funds towards the priorities that the county is doing for administrative purposes, we could roll yours in. If you want to do different priorities and different RFPs, you're going to do it on your own, because we're not going to carry additional administrative responsibilities for issuing RFPs for other jurisdictions.
Got it.
All right. Any more questions on the OAC and the work? And like I said, the OAC, again, has no authority or discretion over the use of anyone else's funds. It was clearly identified and over Spokane counties, but that is something that the OAC, as we begin meeting, will begin formulating and will be published online. So for our website, for the projects that are in those specific counties, per the administrative requirements of the One Washington MOU, we'll have those published in the forthcoming in the next couple of months.
Those are being worked on currently by each of the governments. So we're working on getting those published on the website once we receive them.
Next slide.
We're going to talk about that in a second.
All right, now we're jumping into what has Spokane County been doing, and you're going to get a handout here. So we've got quite a bit of handouts. This one is the raw data from the survey results from Spokane County residents. So it's a little bit challenging presenting this because we had to collate it. You'll see over 202 respondents from Spokane County gave their feedback. Jessica will talk about a little bit what that looks like. That's what you're receiving now. Again, that link can be provided because it is a lot of information, and a lot of the survey results require a lot of in-depth time going in through those. But we were able to meet and go through those pretty in-depth, so you'll be able to get a summary from our update today.
Thank you, Justin. So as Justin shared, we had our survey open from, I believe, November 1st to December 4th. And in that time, we received 201 responses. If you do click on the link or look in the information that was just provided, you'll see listed 202 responses, and that's because additional responses have come after we already closed the survey. So anything above that 201 was received after December 4th. We had a 77% completion rate, but keeping in mind that part of the survey was optional, so to take that with a grain of salt. Out of the people that responded to this survey, a large portion were professionals working with those that were affected by the opioid epidemic, and that was 55% of the respondents. The next highest category of responses was Spokane County residents or stakeholders that had interest in the opioid epidemic. And then the third highest response was individuals that had a family member that was impacted by the opioid epidemic. So next slide, please. So getting more into the Spokane County survey results, we had this shows the priority, the most responses for the approved uses, which are outlined in the One Washington MOU, with the highest being people thought we should focus our efforts in supporting people that were struggling with opioid use disorder. The second highest priority identified was the treatment of opioid use disorder, with the third and fourth coming in with connections to care and addressing the needs of the criminal justice involved. Keeping in mind that, so as you see them listed up there, this is the number of responses total. So when you look at number 4, so addressing the needs of the criminal justice involved, that was actually ranked as a higher priority, but had less responses overall, if that makes sense. So that's why you're kind of seeing a little discrepancy there.
Sorry, go ahead.
Just for clarity's sake, the survey priorities that were identified come from the One Washington MOU. So that's how they were determined. We just pulled directly from that agreement, highlighted those main categories, and that's what individuals responded to. I apologize.
So when you talk about supporting people in treatment, put brackets on that for me. What does that mean? Does that mean housing? Does that mean food assistance? How broad is that support look like?
So that it's very broad. It goes at everything from transportation, connecting people to care, using navigators to get them into the services they need, housing, as you referred to, connecting to employment. It's a very broad category. And you can see the details are in the One Washington MOU of what it can be used for, and it's about a page long. It's very detailed.
Okay, thank you.
I guess I would just ask quickly, supporting people in treatment versus treatment of opioid use disorder. I mean, because to me it's almost similar. Yeah, I don't want to say the same, but it seems similar.
Definitely. So the supporting people in treatment is everything that we've covered, and then the treatment portion is the outpatient treatment, the inpatient treatment services, detox, and medication-assisted treatment. So it's more focused on those clinical treatment modalities versus everything else that helps a person stay in recovery, if that makes sense.
And whenever you take a look at the One Washington MOU and the approved uses, you can see there's a lot of crossover, especially in those priorities. The goal there was to expand it as much as possible to direct to the specific treatment. And really what we are trying to do is say, this is what the public's looking at, and then their specific feedback, but what does it look like as it compares to gaps within the system that are already being paid for either by Medicaid or state-funded services. So that's where we're gonna get more down to the specifics about what this means in terms of priority or specific areas we're recommending.
Next slide, please. So the next slide shows a map of Spokane County and the responses we received per zip code. So this really just shows that the survey really did incorporate a wide range of zip codes all throughout Spokane County. Of note on this slide, 14.3% of the responses reported other, and this could mean a range of things. It could mean they work within Spokane County, but they don't, they're not residents of Spokane County. They prefer not to disclose, or they just had another reason for filling out the survey other than being a Spokane County resident. Next slide, please. So this next slide is really where we get into some of the details of the survey results. These are the narrative responses in relation to the question, asking for feedback related to specific programs and needs. The size of the bubble correlates to the number of responses. So the bigger the bubble, the more kind of responses we had in that area. We broke it down into these 6 categories. So substance use treatment, supporting the needs of pregnant and parenting women, including babies with neonatal abstinence syndrome, therapeutic courts, supportive housing, support for first responders, and the other or special call-out section. Approximately 47% of the responses were in this other or special call-out section, and that's because this, again, was a very broad category. It was kind of our catch-all. Some things that I'd like to note within that category, that these responses included everything from the need for transportation assistance and needs for increased wages for those working within the opioid realm, so substance use disorder professionals and such, as well as Narcan vending machines, as well as a desire to incarcerate individuals experiencing opioid use disorder. So a very wide range in that section. Yes.
Do you have an expectation that the funding that's available can cover all of these items?
I'll let Justin take
Yeah,
that
no,
one.
that's a great question. I don't believe that'd be sufficient to cover all of the requested needs, but I think it's important to take a look at it from a different perspective. There's quite a bit of money that's available from Medicaid and non-Medicaid sources that are already in place. So let's say substance use treatment. Quite a bit of individuals who are being served, and even the SRSC for opioid use disorder are co-occurring. They're receiving Medicaid coverage, which pays the entirety of that service. We wouldn't want to duplicate or replace that, in a supplanting way. We would want to work alongside where are the gaps where people are not receiving services. So those individuals who desperately need it but cannot have funding, that's what we're saying is our focus or the priority. So instead of looking at every problem that exists, we're going to look at where's the ones where the state isn't funding and really narrowing it that down in Spokane County to address the critical issues.
Thank you.
So the next highest survey result in this section was for substance use treatment services. And again, that included the need for additional detox facilities, expansion of the Spokane Regional Stabilization Center, and expansion options for medication-assisted treatment. The next largest was for pregnant and parenting women and babies with neonatal abstinence syndrome. Within that, it was noted an increased need for services for babies that are struggling with NAS, as well as expansion of Maddie's Place, which is a program locally that supports babies and with neonatal abstinence syndrome, as well as their parents. about 10% of the responses noted the need for supported housing. This included support for people experiencing homelessness, expanded housing options for people that were currently experiencing opioid use disorder. And then we also had a large portion mention the need for therapeutic courts. There was mention of needing medication-assisted treatment courts, as well as expanding upon our existing therapeutic courts.
Can I pause you real quick? Is the size of the circle related to the number of responses, just to clarify that?
Yes,
Okay.
yes it
All
is.
right.
It was really difficult to get this in one slide, so it's a little small.
Okay, thank you.
You're very welcome. And then 4% of the respondents mentioned the need to support first responders with mention of the Spokane Paramedic and Referral to Treatment Program, as well as the Frontier Behavioral Health Co-Responder Program. So from here, next slide, please. We took all of this information and then we put together our Spokane County Priority Review Committee. This committee helped to narrow the scope and collate the information from this survey, as well as pull upon their expertise in this area. This committee was made up of subject matter experts from various backgrounds, including some internal representation from our department, and I facilitated this meeting. So through collating the public feedback, the input from this committee, our next slide will show the priorities identified within the Spokane Priority Review Committee. If you can move to that slide, please. There were 4 priorities identified from the Spokane County Priority Review Committee, and those were also in line with the One Washington MOU, so you'll see the section that correlates with the priority that was identified. First priority was support for first responders, and then the second one was addressing the needs of pregnant and parenting women and their families. Third identified was the treatment of opioid use disorder, which we talked about already earlier. And then fourth had to do with the prevention of overdose and other harms. And more detail on that one is the distribution of Narcan for first responders and others that come in contact with people struggling. Questions on that? I think I will turn it over to Justin as we give, from this, we narrowed it down even farther to a few of our recommendations.
Yeah, so again, at the direction of the board, identifying what are the key areas within the county that need to be addressed, but at the same time, taking into account what areas are already being funded and what have been priority areas or gaps we've identified historically. So you'll also see as one of the attachments, we have published, and CSD did this last year and have updated the settlement funding priorities list that our department has identified alongside the funding we already received from the state and from our crisis system. So this was identified in advance, what was coupled within this review or the recommendation. So next
Next slide, please.
This will identify key areas that we have already discussed and looking at ways that we can implement either one-time funding allotments and or ongoing sustainable funding. And I think that's key here because Spokane County has received some one-time funding allotments as we've, from July till now, where we've had some into account. And then we are looking at projecting what is the amount we should receive on an annual basis, recognizing that not all of the settlement dollars have come in and or we're still projecting some that could possibly. So what do we want to commit ourselves to that we don't put the agency and or provider or whatever project we're doing in jeopardy later of not being funded. So we have a couple ideas in terms of what do we use for existing funds versus sustainable funds, and of course then to the board's discretion, how would they like to use those? One of those is recognizing the need for housing and housing support for women with opiate use disorder who have had children and or babies and looking for a safe and stable environment where they can transition from going in from unstable housing or unstable areas, needing treatment and support, but also in a safe environment where they're consistently getting that therapeutic milieu to allow them to really function well, and then also be successful as they transition back into independent living. And so one of those areas was Maddie's Place is looking to expand housing on site. Right now it's a time-limited support for women who had just had babies, but long-term, they're looking at expanding those. So one of those was identified with Maddie's, but this could be for various other agencies in the community that also do this. I believe Salvation Army also has a transitional housing, and really saying there are housing options available, but is it in a safe and therapeutic manner that really achieves the goal we want, which is to have abstinence and a reduction of that engagement with individuals who may have fentanyl or other opiate use in the community. And then so that would be like a one-time investment to look to expand that. That's a recommendation that the Priority Review Committee and the gap analysis from CSD identified. The second is expansion to look at behavioral health co-responder program, specifically as it pertains to fire and or paramedic EMS units. We have one with our sheriff's department, but we're also finding as individuals who are experiencing substance use disorder and are met in the field are being brought to the hospital, which increases the hospital's load within the emergency department before their transitions. By expanding the fire model, they can do emergency reviews in the field, clear them medically, which is what a lot of facilities require prior to transition into treatment, and they would bypass the emergency room, freeing up resources to treat individuals with critical medical conditions and transition them into a treatment facility like SRSC. Again, necessary for clearance to ensure either for comorbidities or other medical complications and for substance use impairment. So that's one area. And then the third one being community education and naloxone. Now this is pretty expansive. Community education could be anything from holding a rally to having a really integrated program that teaches and educates youth in a school-based setting. So our recommendation here and of the Priority Review Committee was creating or putting out a prevention program for youth and the community that looks to intersect within the school systems and in community businesses, support, educate on naloxone, provide naloxone, while also trying to do upstream prevention as it pertains to individuals who may be for the first time experiencing that window into opiate use. How or what that program looks like was not specified. I think there are some national ones we'd look at, but it is something that was identified as a key intervention point, either with law enforcement involvement or other existing groups within the community. So those were the three main ones. A fourth option that we also identified was treatment. So quite a bit of Medicaid and non-Medicaid funding that the county puts out as well. For the non-Medicaid portion, does fund individuals at the SRSC or other subsequent inpatient facilities. We're talking anything from residential treatment 3.5 ASAM all the way up to withdrawal management 3.7, where it's more secure and requires medical detox. And so a lot of funding already exists, but there's individuals who have private insurance that doesn't necessarily cover all of that. But because they make a certain amount, may not have access, we're seeing an increase of those individuals and potentially youth that want to seek treatment that may not have available access to their insurance right away because their parents are the ones named on it. So those are two key areas we could fund. The state does or would have money or may not have enough to cover certain areas. which would remove barriers to access. So, and there's 4 key areas. Really, we're looking to the board for what are the priorities if we look at all the information provided that the county wants to focus on. And secondly, do we want to look at specific projects and then that are either already funded to expand, which may be the easiest way to get the money out, or looking to open up an RFP, which would open it up to a much longer or lengthy process administratively to select, award, and then push out new intervention modalities. So that's kind of where we're at now. We have a couple different areas I think it could work, including I've been looking at SRSC and talking with them about, hey, can you expand and take on sobering, which is not a covered service through Medicaid, which allows for individuals, you may be familiar with STARS, that use the detox drop-off for 23-hour, to expand and allow for someone to immediately go to have 23-hour sobering and then release back to the community, kind of like a triage center. So we've been in talks about possibly creating or expanding something like that. And since we already contract with SRSC, it would allow for that expanded model on what they're already doing. Again, a lot of discussion on what that would look like long-term, but just ideas that we're putting out. So, a lot of information. I wanted to present to this board and see if there's any input or direction for next steps.
Thanks for this. Really excited that I'm glad that we took the time to gather some good community input. Just a quick question. So on the packet you gave us, is there 66 narrative comments? Okay.
And yeah, in addition to that, you'll have, if you see the link, I think it was provided, but we can also send that out again. You'll be able to click through and actually see all the narrative responses. It was difficult to get it on paper form.
Okay.
But if you can review that in more detail with the link.
I just am looking forward to taking the time to read those comments. I noticed we got dozens of comments from treatment providers, and as you said, people with lived experience and family. So I'd like to take a little time and see exactly what they had to say. Really appreciate the committee's recommendations and then your kind of gap analysis as well. I personally think it'd be good for the board to review this information and schedule a strategic planning in a couple of weeks to kind of dive into some of the specifics and talk in greater detail about some of the possibilities and how the various funding pieces fit together and really get into it at a deeper level. So that's my thought. But I think it's a really great place to be right now.
Thank you for all the presentation and all the time you've put into gathering the community input and then the committee. So what was the priorities versus the recommendations? How do those follow? Because it sounds like what you were just talking about, like the need for more detox, like walk-in place for somebody to be able to go to be able to detox is a need or an issue, but you don't have that on your top 3 recommendations. But if we don't have those places, where will the first responders be able to take people?
So
I'm just wondering, how do those two interplay? Like, I love the idea of investing in our first responders and allowing them to be able to take the burden off of law enforcement to really medically address medical needs that people are experiencing. But then where do people go? Because I know the model right now with the RCSC, am I using the right acronym? SRSC. Is it really has to be recommended, they have to be brought there either through the ER or like a first responder, correct?
And they'd have to be medical necessity, and that's the key issue. They would have to go through an insurance review to determine they meet that. They get a set amount of days they're approved for, and then insurance will pay for that, just like anyone who has private insurance. Medicaid will pay for the entirety of whatever they approve, but it is limited, and so not everyone who's dropped off meets medical necessity criteria or would be approved. Sobering, since it is not covered by Medicaid, since it doesn't really have a medical necessity, which is different than detox.
Okay.
Means individuals, don't need the attentive review of a doctor or a medical professional to see them, but they do need a safe place to stay until they resolve a lot of the substance use involvement. That is something we're looking at expanding, and it does fit into this because it is one of the areas that if we were to look at partnering as a fourth option as treatment, it is an expanded area. The three top recommendations are ones that aren't currently funded or at a limited capacity from the state and federal government. So that's really key. We want to look at what would the gaps be. Treatment is covered almost entirely except for sobering.
Got
We
it.
currently fund it now, and we could expand it with block grant dollars, but opiate dollars are not limited to individuals' income. A lot of federal dollars are limited to if they meet federal poverty level at a certain percentage. But you could use opiate dollars to expand and incorporate more individuals regardless of their income level. I think that's a key gap.
Right. And have you thought about like the mental health sales tax as well, as how that could interplay with some of these?
I'm always thinking about that. And
That was
how
a
it fits in
leading
there.
question, I guess.
Yes. But I think it's important to recognize where can we utilize the opioid dollars, either the one-time amounts that we have and then the ongoing sustainable. And then if we find, and the board directs us to put it in an area, does it require additional funding to support that, or could we completely support it with the opiate dollars?
Right,
I think that's the question. At that point, I would recommend looking at sustainability and then coming down second, because with mental health sales tax, being very specifically approved for certain areas, whereas opiate dollars are a little bit more expansive in substance without limitation, then I would argue looking at those gaps would probably be the best use of those funds, and then using mental health sales tax specific to the areas that the statutory limitations apply.
Okay, so the opioid settlement dollars are the most flexible,
Yes.
and then you go to maybe the mental health sales tax, and then you get into some of these insurance and limitations around who's covered for what. Okay, thank you. You know, I would love to dig a little bit more, like I think a strategic planning session would make a lot of sense. But I really like where you're going to try and balance the response side, and then and the use of Narcan and but then also trying to fill those gaps where people can't afford different things or don't qualify.
So I think I'm gonna suggest too, because I think this is a lot of information that we got, that I have more questions as well. So if we come back in like 2 weeks, and then commissioners can ask you questions during those 2 weeks to get further questions answered and identified, it's still coming back to a strategic session, so that way then we all can discuss it together. Because I know, like, I think I talked to you, Justin, about the Yakima County. They used all their opioid settlement dollars to do education in the school system. So there's a program, national program that they're using, that working with the school district superintendents, that they're gonna put into the school system. Kind of like a DARE program from old. Not quite like that, but as I was talking to the commissioners there, that, you know, has the data to support that it's a valid program that is successful. Because, you know, again, prevention's, you know, for me, I think prevention's a big thing. You know, as we have more and more of these pills on our streets that are cheap, we're just seeing that issue, you know, so the more that we can educate, you know, our youth that don't even try it once, you know, it's gonna be, you know, a good use as well. So I think as we, you know, I think community members have reached out to all of us too, so I think it's good for us to all be thinking about and have you come back. But definitely ask more questions of Justin and Jessica, you know, in the meantime, to get, you know, further answers so we can be really productive in the next session.
Yeah, I just, you know, this was a great presentation. I think, you know, that want to also circle back to one of the things that you both alluded to earlier, is essentially the need and the priorities are much greater than the funds that are going to be available. So I think we need to be honest with ourselves that we need to utilize these dollars as, you know, as effectively as possible, and just know that we can't do every single thing out there because the funds just aren't there to do every single thing out there. So I think you have a great top three here as far as the recommendations. I think, you know, these are things that we know make an impact. I mean, we all toured Maddie's place. We've received the presentations about the co-deploy teams, the co-responder teams. That has a measurable impact. And then community education, I mean, is, you know, to what Commissioner Cuny was just touching on. So, I mean, I think it's a good list. What you have as your top three.
One last thought. You talked about your kind of fourth bonus, your bonus prior recommendation. Can you get that can I get that in writing? Because you explained it, but I don't know if I'll retain that.
Yeah, and it's part of our other document. I know there's a lot of information that identifies some of the funding and treatment priorities. Again, that takes a little bit more complexity in terms of what we're looking to achieve, because it would go alongside what we're already funding.
Is that what you're talking about? The sobering would be the fourth priority?
It would be treatment services in totality.
Okay.
And sobering's one of those. The challenge being, I could talk ad nauseum about what we do fund and how it's determined. The question being, if that's the route the board would like to go down, being more keen on where does that lie, because the uncovered areas is at or below 220% federal poverty level is covered. Everything beyond that with private insurance is up to the private insurance. Now, a lot of that doesn't cover some of the services like withdrawal management. Does the board want to cover those? We already pay for all of the involuntary services as part of the ASO, but they switch over to voluntary. That's a lot of money that could go quickly. You're talking like $2,000 a day in some of those inpatient beds. So you're talking about a small amount of money. It's why we didn't identify it as a key priority for, because the state, it does provide some funds for that. And our recommendation to the state is then expand more on that for our small pot of money, whereas the biggest.
So that might be a state ask, like.
It's always an ask for us, yes.
Okay.
We always try to maximize the use of that, which is why I tell you, like the mental health sales tax dollars is always something we present to the board. And when we look at a key area, can we maximize that for Spokane County residents?
Great, thank you. I'll ask more questions and we'll get it on, future agenda.
So hopefully in 2 weeks,
Yeah,
just, so we can keep the conversation going.
yeah.
Okay, thank you very much.
Thank you so much.
Appreciate all the
Have a wonderful day.
information. Okay, that's gonna take us to Matt's report and Kyle.
Good morning, Commissioners. Try to make up a little time for you here this morning. We have a pretty quick and easy one for you here with regards to a traffic code revision.
Good morning. Yeah, this is one of those we'd like to bring to you. We're removing weight restrictions from a bridge that's been repaired. Just going to take 1 minute to showcase this one. I think you've all heard from us, the National Bridge Inventory addresses our bridges over 20 feet. This was one that was under 20 feet, so it's not eligible for federal funds. Our bridge team looked at it, and the initial solution was to replace the bridge for $450,000. It serves 2 residences, and we have a lot of these where there's very, very low volume, essentially a driveway. And they took another look at it and they got creative and they elected, the problem with the bridge was the piles that it sits on were rotted out. And they came up with the solution to cut them off below the rot and cap them and put a new structure on top. It's a semi-permanent solution, they're calling it, but it gets us 25 years for $65,000 instead of the $450,000. So just really wanted to thank our team for their creativity and their being cost effective. Those are all county dollars, so we really pay attention to those. And I think we're going to be doing a lot more of that going forward, just trying to come up with the most cost effective solution when we have a problem with, especially with these small, low volume bridges at the end of roads. Happy to answer any questions. Okay. Thank you.
That was it. Okay. Awesome. Now, and I do have to say, Matt, your team does really well with, and Kyle, on those small bridges that are just becoming more and more of an issue, so.
Yeah. Thank you.
Okay, that's gonna take us to Jeff. There we go. I'm like, I thought you were sitting down there and.
I got Mike Burgess, the info for Olympia.
Okay, thank you. And Dale, and is Heather joining us or is she?
Heather will be online. She caught the COVID, so she gets to work from home this week. We'll try to spare her voice. It didn't sound super strong this morning.
Okay.
So this is, listing in your packets. Also brought hard copies. Keep up my reputation as a tree killer.
At least you're self-aware.
Exactly. This is a letter that we would like your permission to kind of send out. Normally, something Heather would just do, but the nature of it and the nature of these awards and people who know you and the phone calls it might generate to you, we wanted to make sure you were aware and okay with it. Ron, let's go back to the PowerPoint you just had up first as a little bit of background, and then we'll kind of talk to the letter. As you guys are very well aware, we've had 17 amendments, we'll call them, to the original final rules. And we're at a place where they have been redefining the word obligation. And we had some conversations last spring when we did some stuff around obligation. At this point, you'll see up on the screen, this is a CFR. They are pulling in, it used to be the money was obligated once we gave it to somebody, nonprofit XYZ. Now they are saying that that nonprofit or awardee, if it's another local government, must have the money fully obligated. So like if you are getting a new roof done on your house, for example, you can get the bid today, and you can get it done in 25 and 26, but you need to have that bid contractually signed by both parties. And you know who is gonna put the roof on your house, and the price is set in stone. So by the end of this year, essentially, you're gonna know where every penny goes. That creates a different timeline dynamic than just knowing they're gonna spend the money on housing upgrades. So this is a letter to let everybody know exactly where we are. Of our 65 awards, created 60 contracts, because some people got more than one and we combined. Only 7 of our awardees are 100% spent. So we have 53 groups out there. We've talked with them. Heather and I spent a lot of time on the phone over the holidays when it was not quite as busy around here, having a lot of conversations with awardees. But people also hear what they want to hear sometimes. And we're just finding some challenges here. So we'd like to put it in writing. We tried to hit that balance between being pretty blunt without being rude. The reality is, if money is returned, we'd like this to have a June 30 drop dead date. That as groups, we want you to tell us exactly where it's gonna be spent. Your RFPs have been out, we can give you a little flex room if the RFP's out and you need to get it signed. But you need to start today getting your RFPs out and your ducks in a row. You'll see in the letter in red, there's 3 places. If you guys wanna push it out, we think August 1st would be the absolute kind of drop dead, because the reality is, if you guys want to re-RFP it, you start looking at Thanksgiving to Christmas. If the RFP isn't in place before Thanksgiving, we're not gonna get the contract done by the time you negotiate a contract. And then historically, like last spring when we were obligating money, we just got the contract done quickly because we knew we could amend it. In this situation, we can't amend any of these contracts. The only amendment they are allowing is if the person you've contracted with literally has gone out of business, you are allowed to get another person to do the exact same scope of work for the exact same dollar amount, which might be difficult if it's 2026 at that point and your contract was based on 2024 prices. So we're really encouraging people, especially people that have multiple different funding sources, spend our money first. It's running out. So this is a letter to push on that. I'll stop talking now and wait for feedback.
So I had a conversation last week with Chris Pinkra with SDR3 about the funds there. And so he's indicated that he's working with the city of Spokane to where we will use the $1 million for the water and sewer to cover preliminary engineering and right-of-way acquisition so that we can have those funds spent and be part of that project. Still reduces the overall nut, but at least we can, so do you think that would meet the qualifications in terms of having those funds committed?
As long as they've either done the A&E and we're paying it now, or it's under contract to be done.
And consistent with the original award, yeah.
Okay.
That's exactly what we're looking
Yep.
for, is people
Okay.
to move.
Pull the trigger.
Okay,
Move stuff forward.
good. On track.
So a couple things, I know, like that second sentence, somehow I like to word it that this is the federal government that is constantly changing their interpretation or their
Definition of terms.
that is, I mean, it's a moving target for all of us.
You could change further to yet another. I mean, it's kind
I
of,
mean, I think I just wanted it to be
Yeah.
clear that this is not us doing this.
Yeah.
This is
This is federal.
Treasury that is doing this and requiring this, because that was certainly not how it was first,
right.
when the ARP dollars were first given out and as we were doing our contracts. And I'm gonna be back at the legislative conference for NACO and at their board meeting, and I'm gonna be asking a lot of questions on this, because I know NACO's been, kind of trying to be the forefront of asking the questions on, what does really obligation mean? Because certainly we had interpreted a little bit different than even what WASAC was interpreting it.
Yes.
So I'm, that's like the 8th of February.
And then
So,
I'll work on getting those talking points.
yes, because I really want to press them on what they're really thinking this means as well. So it's a full interpretation that we're gonna get clarity on.
Just for your information, Commissioner, this is, I believe, is the 5th amendment to the guidance and
Of obligation.
no, the ARPA guidance coming out of Treasury.
Oh, I
So
see.
it's basically every 6 months they've been kind of adjusting and changing it, so it's unfortunate.
The last
It is, and they're
treasury,
certainly looking to try to bring back as much money as they can, and not
Right.
run out, but it's also, we were in good faith in getting these dollars out there to, meet the purposes of what, ARP was supposed to be for, and I think we did a good job to get it out to our community, and so it'd be really frustrating to see it not be able to be used. Because just like we know on construction, as Commissioner French was just talking about, we're not gonna know for some of even our internal construction projects for ARP, who that contractor specifically is going to be in 2026. And so that's where it's almost irrational as to what they're trying to do, because you can't commit, someone's not gonna commit this far out because they don't know what those costs are gonna be. So for some of these construction projects, so.
Heather and I
So the government is
will
not
have
helping us at all.
that
Well,
conversation.
it's a great way to reduce the amount of funding that they have to actually come forward with and just make the process so flippin' confusing that no one will comply.
Claw back without clawing back.
Claw back without, without actually doing a clawback. Just make the rules impossible to adhere to.
Which is just hard on the community that has, in good faith, gotten those dollars to know that they had till the end of 2026 to spend them. Which was part of what they gave us the need for, not knowing that they had to have it specifically in a contract by the end of 2024.
Yeah, we thought it was more the concept was something like 24, not this level of specificity. So talking with Heather, we're talking, if they're spending it on wages and benefits, that's okay, 'cause that's not a contract. If they're buying staples and tape for their admin, that's okay. This is any capital project that you go out to bid for, which we have a lot of money under that. If you're hiring consultants, where it is a contract with the employment, and then any asset over $500. So if you're planning on purchasing a new high-end printer, Because there's specific asset tracking that goes with assets over $500 that's pulling that under these rules. So those are the kind of the three big categories that we've identified, and they are big. You know, if you're a nonprofit, depending how you're looking to use these funds.
Which I would say again is frustrating because then you're using one-time dollars to support a salaries and benefits. And that wasn't the real intent.
Well, and we've
But
tried
it's
to
forcing
minimize
people-
salaries and benefits
Right.
because of that. We were heavy on the
Right.
capital
So
side.
it's forcing us back to doing that, so that's the frustration.
So refresh,
Uh,
I'm sorry.
Commissioner Jordan then.
So just looking at the year schedule and kind of what we expect. So in April, you'll give us a presentation on the status of the spending.
Sooner
right?
than that, we'll give you early February, you will see from the year end, and then April again after Q1.
And then either June 30th or August 1st would be a deadline for the awardees to have a contract in place.
Or show us where they are. Because that way you guys can make the decision, we're comfortable they're gonna get there over the next few months. But if they haven't even gone out to RFP at that point, I would suggest you shouldn't have a high comfort level. And then your choice is, are they really gonna squeak it in by December 31st? Or does it go back to Treasury?
Do we have the discretion to take back unspent money?
So about half of your contracts actually expire June 30th of this year. Our template put pretty much all of them expiring June 30th because we wanted to have this check-in. I mean, it was written in with an extension to make it easy. But pretty much any group that pushed back on that, our own internal MOUs, which we got a lot of jurisdiction over, are at 12/31/26. So we're about half of the contracts actually will be June 30th, which is another kind of a nice meshing up if the letter's dated June 30th. Half of the contracts are 2/26. Every contract has a termination for convenience on 30 days on either side. Every contract also has a section that essentially says if the feds change the rules
Okay.
as such, that we have to amend the rules, then, you know, so we have both of those things that would allow the board with notice at a minimum of 30 days to do this. So if we-
Follow up then, so we then would have the ability to, if there was shovel-ready projects or something we could quickly redirect to, rather than sending it back to Treasury, we could put it to something else that could get obligated by the end of the year.
That's the purpose of the June 30. So if you look at your timeline, allowing 6 weeks at the end of the year and the holidays to get a contract done, it takes us, if everything went perfect, which is never the case, we could turn an RFP in 5 weeks. But 7 to 8 weeks is probably about best case scenario with a 3-week on the street and then the cadence of commissioner meetings and the votes before and after. And then if you're, so that's say 2 months, but then if you have, we take 2 months to give it to nonprofit XYZ, they're gonna take another 6 weeks to put out their RFP to the roofer, so to speak, and then you gotta get that contract in place. It's a pretty tight timeline. If you use the funds internally to the county, then you only have a 1 RFP cycle versus a double RFP cycle. But we still, even with the county, you know, Kyle is working to figure out exactly how this is gonna work with the capital projects in his shop. We've been talking with Doug Chase. You guys know there's the big West Plains, you have $11 million out there for Plans Ferry in West Plains. Need that under contract. So a lot of, even internally, we're doing everything we can to spend now. And if for some reason it can't get spent this year, we wanna have it buttoned up where we don't return money to Treasury. That's our goal, unless you guys give us a different one. Are there anything to add?
Nope, Jeff, I think you covered it.
Hope you feel better.
Thank you.
Oh, I was just gonna say, you might wanna move the bolded sentence on the back, like up or something, I don't know, I think maybe you need to be a little bit more. If your organization does not plan to have all its,
So kind of
like
front
I would
load
move
that
that up to like the third paragraph, so it's very clear. And then you kind of go into, well,
Here's the background why.
if you can't do this, or if you have extenuate, like you need to send us, you need to call us, you need to send us your plan, like,
Start talking now.
yeah, we wanna hear from you. So you're not saying that like, oh my gosh, let's say they're in the middle of an RFP process, or they're in the middle of getting bids, or what have you. But I think you kind of have to scare them a little bit, right?
Yeah, the hope is that they'll demonstrate that they've actually taken action and
Right,
taken
right.
affirmative steps towards allocating those funds. And that's, I think, from our discussion, that's all we're looking at, to demonstrate that they're actually moving the money. For those people who aren't, I think, we really should look at reallocating.
Honestly, we have about 10 to 15 groups that are on some level of our concern schedule. Most of our groups are pretty good, but 10 to 15 is still a lot.
So Commissioner French, and then we need to keep moving.
Well, I just refresh my memory, ARP stands for Administration Redo Program?
Pretty much.
Yeah, okay, I just wanted to clarify that.
That's the working term.
That's a working term, yeah.
So with those
So
amended,
we want to get this out by the end of the week, right?
that's our goal. With those amended changes, are you
I
gonna
would
be
vote
sending
June,
it?
I would say June 30th, because then it lines up with some of the contracts, as well as it gives 6 months for
Well, thank you.
if we need to reallocate the funds and go through other bidding or contracting processes, either internally at the county or with external partners.
Yeah.
So I think
We will
there's probably only gonna be minor changes, and this is going under Heather's.
Heather would send this out
signature.
via an email.
So I would say if anyone has any other minor changes to it, to get it to Jeff by the end of tomorrow,
Yeah,
Wednesday.
that'd be fine.
So that way it can get out this week.
And we'll do those changes that have been suggested and send it around quickly, just so you guys can see that if that works for everybody.
I was just gonna point out, the third paragraph, it just says, if you're the agency has not.
Commissioner Jordan just forwarded that one.
Strike,
Thank
strike
you.
the word the and you're good.
I hate the typos that spell check doesn't catch.
But that way then you guys can get this out this week, but
Yeah.
then that gives us till the end of tomorrow to.
And it is giving, all of our partners in this, close to 6 months to do what they need to do. But we just felt this was at the level you guys should be highly aware of.
And I would suggest as we see some of our partners over at the GSI Fly-In, we let them know that this letter's coming and we give them a heads up as to why as well. And again, that I'll be asking a lot more questions. I've asked, the team to give me kind of the talking points that they have, as well as if anyone else has talking points for me to make sure, or clarifications to get when I'm back at NACO. Because, this is.
The jumpstart to this was NACO hosting some high-level treasury people for a Zoom right around the holidays.
It's about 3 weeks ago.
Yeah, and that's what Heather and I were like, oh boy, we need to talk to the commissioners once they're back.
Well, and when most of these contracts were signed,
In 22.
so,
In 22. So we actually did that. Most of them have been aware of their money for 15 to 18 months. They may not have their contract signed, but they knew the award had been voted
Right.
through. So they've had a runway.
and I realize infrastructure projects, like Mr. French, you're talking about, it does take some time to put those together and, but I think this is important. We don't wanna,
Don't want to lose it.
no.
Okay, so Chris, I'm gonna see if we delay your
That's perfectly fine. Yeah.
your item until after we're done with the federal delegation,
Certainly.
since we're now at 10:30 and we asked them to be on at 10:30. You go to the back page.
You're gonna have 2 people from each congressional office on this call. Those are listed. We also invited Luke Jasmine from the governor's office, John Colton from the lobbyist team, and Chandra is up there. So it'll be a very full screen for me.
Okay, and who is leading this?
Chandra was gonna take lead from Zoom since she is also under the weather today, could not be here in person.
Lots of bugs.
Yes. Let's see. So Pat, maybe I'm gonna have you just do introductions.
Sure.
Finally over.
Don't mind, so she kind of helps set us up just a few nice to meet her in your opposition.
Commissioner Cuny, do you kind of want to frame the discussion?
That's what I'm having Pat.
Okay.
Thank you.
Have everybody?
Have everyone?
Just waiting for Lisette.
Hi, this is Katie from Senator Murray's office. Lisette's not gonna be able to make it. She actually had a bit of a health scare this weekend, so I am filling in for all Team Murray members and will, give her an update after this call.
Okay, very good, thank you.
Do we have Riley?
We have the second person from.
Anyone from?
Hey everyone, this is Hallie from CMR's office. Good to see you guys.
Hi, this is Megan Thompson from Senator Cantwell's office. I believe Riley should be joining, but I work out in Washington, D.C. for Senator Cantwell.
Very good, and then Jasmine was the only other one. Okay, we will go ahead, it's 10:30, so
Sure.
Patrick, I'll let you go ahead and get started.
Sure, so just working with Jeff to get this set up for the board. We have the congressional delegation represented here, Senators Murray and Cantwell, the Congresswoman's office. I know at various points there have been follow-ups with the White House and with FEMA and with the delegation about wildfire recovery. And specifically, there was interest expressed in a briefing on the status of the individual assistance requests that Governor Inslee made to FEMA and the White House on October 4th. We're now into mid-January. It's been 5 months since the fires and 4 months plus since that FEMA request was submitted. I know 2 commissioners, I believe, sent a letter to FEMA encouraging answers and just trying to understand where things are. And I know Chandra and others have been in communication, so just bringing everyone together. And I know the commissioners were interested in asking questions about how to properly advocate with the White House. Having been to Region 10 with this letter and getting answers back that they have all the information they need, I think it's more a question of what advocacy is appropriate now. But also wanting to turn to the congressional delegation and the individual offices for any status updates you all might have. Does that sound good?
I can go ahead and go first. So basically, I guess just to give a rundown, I'm sure this is things that people already know, and apologies, I have a bit of a cold, so I'm sounding more nasally than usual. But when we, of course, the fires broke out, immediately Hallie, Megan, and I started to coordinate so that we would be able to support the governor's request as soon as it was made. So we all coordinated very closely on our letter of support. We sent that literally the moment that the governor's office sent their request in, and I was sure to elevate it with all of our contacts at the White House. We have a couple of folks who moved over from Senator Murray to the White House this year, so I flagged it for everybody. Note this was an important request. And then since then, just I'll give my quick update. I know Hallie and Megan probably have things from their boss as well. Lisette and I have been, just keeping in touch on this and just how recovery efforts have gone. And so when, it kind of was getting to the point where I realized wow, we haven't heard anything. I wonder what the update is. And I know she was hearing from a few of you all. I touched base with FEMA in December before the holidays just to get a quick status update and was just given, oh, it's in the queue. We're continuing to work on this kind of a response. So that's what I have to date for now. I know Megan and Hallie have had conversations as well.
I can jump in. So we've been similarly trying to stay in touch with the White House on the status. We saw the letter. We've definitely been hearing concerns that this, even how important it is to get just some type of update on where things are. My chief of staff reached out to the White House late last week. We've not gotten a response, which is not totally surprising given some of the other policy issues that have been going on in our state, but he's following up with them today. And so I'm hopeful that we'll get at the very least some sort of status update as to when any type of decision could get made. This is getting into January, so obviously we understand the urgency of this, and so we're going to continue to work it. And obviously I will share that with you all and with all the other offices on anything that that we get to as well.
And I'll go ahead and jump in here as well. I'll just say that the fires occurred on August 18th. My first day with the Congressman's office was August 21st. So I can honestly say this has been top of mind for me personally, since I started on this team. It's been great to work with Megan and Katie on this. And just to kind of mimic what they were saying, we did send a letter of support in early October, and then obviously trying to stay on them as much as we can to get some kind of response and really, elevate the urgency, and personalize the urgency to some of our contacts at the White House. My boss spoke to the FEMA Region 10 administrator the end of December, and he did offer, him or anyone on his team as a resource to, kind of walk through what the process looks like from here. But couldn't really give any specific updates as to when there would be a decision or not. I think at this point, we are open to sending a letter of some sort if we don't hear back, potentially soon, just following up on our letter of support and the governor's request for an individual assistance. I totally understand that, at this point, y'all just need to know how to best move forward. And, we hope the decision is the right one, and we'll just keep putting pressure on them. I do know as well, my boss has visited several of the sites, in the district, and, she really cares about this, and, wants y'all to have the assistance that you need. And then if you guys had any questions, about how, a major disaster declaration works, where do we go from here? What happens, if y'all get denied, there is an opportunity to appeal the decision. And our office is happy to work with you guys on what that process looks like, and talk to the governor's office as well about that.
And also just to jump, sorry, Hallie, also just to jump on what Hallie said, it'd be really great to hear from you all too. We all know that this process is not perfect. And it's a tough one, it's a tough one. And so if there are things that you guys have seen on the ground that we should know about or that we can help affect back here in DC, I think all of our bosses are really eager to make these processes go more smoothly, but also most importantly, just ensuring that the community is getting, the federal resources they need.
I will say as well, just something I forgot to mention on our part, and I do have our district director, Christina, who many of you know on the call as well. We are working on some kind of, roundtable event to highlight the issue, and hopefully my boss will be able to speak at that as well. I think details are forthcoming there, but rest assured, we'll let each of you guys know, what that will look like.
Commissioner Kurtz and French, do you have a couple of comments?
Yeah, I'll start off by just thank you all for taking the time to meet with us on Zoom here. If I could just circle back to one of the things that Pat kind of led off with was, do you have advice as far as level of advocacy? How hard do we push? I'm sure there's a limit to where you don't want to push too hard because you don't want to turn the decision makers off. But what advice do you have as far as that goes for what we can do as far as advocacy?
Yeah, I think one comment, I wouldn't so much be concerned about turning them off, this is the kind of thing that if thresholds are met, pardon me again for my cold, if thresholds are met, assistance will be released. And I think rather than worrying about, over advocating or something, having an adverse effect, I think, that your advocacy and who you're meeting with could potentially take time away from the work that they need to do to get this sort of like their analyses done. So I think I'm happy, and I'm sure Hallie and Megan are too, to sort of direct you all to the right people at FEMA, or maybe who the right people in the White House would be. My understanding as far as things go right now is that this decision is still with FEMA. The decision meaning, like, of course, the White House will make the choice, but the FEMA has to do all the legwork, right, to make a recommendation to the president. So I personally feel like talking to FEMA and trying to get an update from FEMA is the best approach for right now. If and that, others might disagree, and I'm welcome to those thoughts as well, and we can talk about it. But I would just say that, just warn that I've worked for several different people on the Hill. I've worked through a lot of different disaster declarations. And I've seen that sometimes when people want to, take things to the top, get an update, that it actually sort of takes away from the work that we're trying to have FEMA do to get to the declaration, because they now have to stop their work, go stop their boss, update their boss, and do those things. So that's just something that I would caution to be wary of. However, we have been waiting several months, and maybe that's what it takes. So I'm not opposed to, taking things to the top, trying to get people motivated from the bottom and top down as well, but I just would put that flag out there for everybody.
Yeah, I'll just mimic and say, the more advocacy, the better. I don't think when it comes to major disaster and emergency declaration, and the assistance that comes with that, I think, this request is made because it's an urgent situation. I think the administration understands that. And I'll just put in a shameless plug for my boss's bill that she introduced, a few months ago, Malden Act, that would instruct FEMA to work with state emergency management agencies to make disaster caseworkers available for rural communities in the event that, a request for individual assistance is made. So that is something, I think that our office is working on. Obviously, wouldn't help with this situation, but, hopefully it would help in the case that an event like this were to happen again, God forbid, in the future. As we all know, Greater Spokane area is no stranger to wildfires. And so, we definitely want to make sure we get the assistance now, and God forbid something like this happens again. We don't want it to pile up, so to speak. So.
Well, thank you all for taking time to join us this morning. Or I guess where you're at, it's this afternoon. But I've heard from a couple different sources that part of the challenge is that FEMA is out of money. And so until there is an allocation of more funding for FEMA, they're going to either prioritize or sit on requests. Is there any truth to that, or am I just being led on? And if there is truth to it, what do you think the timing might be to get more funding to FEMA?
I can go ahead and quickly speak to that, Megan, unless you have, I know you were.
No. You guys are, you take it from the approach angle. If I have anything to add, I'll add it.
Yeah, I mean, I would say generally speaking, there is some truth to that. In I know, for example, earlier this summer, the FEMA's disaster relief fund, which is, the bucket of money that would fund these kinds of efforts, was getting really, really low. And so FEMA had to, limit their spending, limit their, just their resources, because they needed to be ready to respond to the most drastic types of emergencies. And so that was a conversation we'd been having with FEMA this last summer. So around the time that the fire happened, either right before or right after. But we, through one of our continuing resolutions, we gave additional resources through a supplement bill to FEMA for the disaster relief fund, sometimes called DERF. I have been communicating closely with my colleagues on the Appropriations Committee to see where the Disaster Relief Fund is at now. It sounds like for now they have the resources that they need to continue to operate like normally. But we are monitoring that very closely, and it's possible that if with the disaster landscape, something could always happen and could always change. The amount of money that's in there, like at a moment's notice. But it's possible that as we work through our fiscal year 24 appropriations bills, that we, try and give a little bit more money to the disaster relief fund. Everything's really, as you can tell with the appropriation stuff, we're trying really hard to get the fiscal year 24 bills done, but there are conversations about supplementary funding from everything for, more foreign affairs issues with Ukraine, with Israel, but then also on the domestic side. I know, for example, I think Megan and I both do agriculture. Hallie works closely with her agriculture LA in her office. Like, we know that there are like some disaster needs on the ag side within the state we're trying to focus on as well. That would come through disaster or through supplemental funding. We're trying to monitor these things. So it's a little bit of a long-winded answer, but for now, FEMA has the money that they need, and we are actively communicating with them to make sure that that's up to date. And if for any reason their funds diminish over the course of the next few months, my boss in particular is ready to make sure that they get the funding that they need. And I know we'd have support from Hallie and Megan's boss on that as well.
Yeah, and to mimic, so something that FEMA does is, I think it's every month, maybe at the beginning, like maybe by the 5th of the month, FEMA is required to issue a report that states where the disaster relief fund is. Like, so you can go online and see that. And I think, like Katie said, the projections look like it's not actually supposed to get like closer to, it's not supposed to get pretty low until the summer. That's pending, like if there were additional funds added, like Katie said, like we came in and then put more money into, which is typically something you do, is we just kind of keep filling it up. But you can look online and actually see that, like where that is. And a lot of times also too is with the disaster relief fund, sometimes that means like they don't, if there's a disaster and like flooding in an area that occurred 2 years ago, FEMA is still like doing a lot of work with that community to help that community recover. That does not mean if funds were low that they don't focus on disaster declarations and relief. A lot of times it just means that the focus becomes these disasters and other activities within FEMA that may be a lot more long-term, like buying out homes of communities that are flooded. Like that's had to stop before, but typically if you have a wildfire or something like that happens, they can still respond. And also, like if you are in conversations with FEMA and are hearing that report is, I can send a link. It's very easy. It's just right online and it comes out every month because they're required to state how much money is in that fund. So people like us and, we're well aware of where that's at.
And I would just add, if you are hearing it from people in the state, at FEMA, honestly, anyone, I'd be really curious to know who's saying that, just so that I can sort of follow the conversation and get to the bottom of what their concerns are. Because, of course, like, we don't want any sort of, we want the, all communities to have the money that they need to respond to disasters. And so if there's some sort of like rumor or logistics getting in the way, like I want to be able to address that head on.
Thank you.
Commissioner Jordan. I just want to thank all three of the offices for your efforts to reach out and, work your contacts, send letters that are all unified. I think it's been really important that all of our congressional delegation is working together. I think one of the ideas that was thrown out beyond, Chief of Staff checking in with people at FEMA, which I appreciate, was kind of a follow-up letter, basically to say what's the status to FEMA. I just wonder what other offices think about the appropriate time frame for such an action.
I'll jump in first because it was our chief that reached out to the White House. So a lot of times like FEMA's doing their work, but there still has to be a process from taking like what comes out of these declaration and the reports, and it goes to the White House. Personally, because we just reached out, I would just like to hear back from the White House on what the status is. And I'm hoping to get that like today or sometime tomorrow at the latest, and then evaluate. If it is something where they don't have a good answer, I think all of our bosses are very open to expressing, like that this needs to come. I will make a nod to Katie's point as well, that like when we do send these letters, they have to go and respond to us. However, A couple other steps that we could, that are always being considered, and I'm just speaking from Senator Cantwell's perspective, is, if we don't get a satisfactory response from the White House on the status and it's not clear, which, could very well happen, there's things that we can have the senator call herself, which can elevate it, which then can sometimes not be a letter that kind of takes away from agency staff. So that may be something that our office would consider potentially before a letter. However, at this point, I think that my boss is really sensitive to making sure that the community has some sort of answer and guidelines. That I don't think there's really anything off the table, but ideally I'm really hoping to hear back today or tomorrow. And again, if it's not satisfactory, my first calls are to Katie and Hallie to discuss how we all address it as, a delegation, because those are obviously the strongest, when you have bipartisan delegation support on this stuff, that's the strongest response. So, letting people you guys know in the community and then going to my colleagues and talking through a way, letter, call, whatever it may be, to get better answers is going to be what happens.
And I see that Chandra Fox, so Chandra is our emergency management director here in Spokane County, and so she just raised her hand, so I'm going to let her speak to it a little bit, because I know she gave us a briefing last week, which is part of why we are having this conversation this week, because we're in sub-zero temperatures right now, as a lot of the country is. And so, people would just need to know what their future holds. And if Chandra's explained to us last week that if there isn't going to be individual assistance, they can't go get those SBA loans until something happens at the federal level from you guys. So it's imperative that, timing wise, that, we all can move forward together and hopefully get that individual assistance that we need. Or if it is going to be, a determination, to get that determination so these people can start to move their lives forward. Because especially those people that are underinsured, they need to figure out what their next step is and not be in limbo as we're in these freezing temperatures and going to get several inches of snow coming up this weekend as well. So, Chandra?
Thank you, ma'am. I apologize. I'm not going to turn my camera on. To echo Commissioner Cuney's comments, that was really what I wanted to bring to the forefront of this conversation as well. We very much appreciate all of the support and the advocacy. We are at the point now where we just truly need an answer. The largest number of our impacted individuals are in that underinsured category. And while we have state money that we are utilizing for debris removal and providing some individual assistance, that is the caveat to that is that 80% AMI. And that is a challenge for us. And we have this wide swath of people who are underinsured. So they have a gap, but they are above that 80% AMI income level, and they would really, really benefit from being able to access those SBA programs. And we've known since September that we are eligible and we meet the requirements for SBA. So my ask to our federal delegation is that you start communicating with SBA to eliminate their rule that our FEMA application must be denied prior to the implementation of the SBA loan program, because that's just simply an SBA rule. There's no basis in law for that delay. It's just an internal rule. And while I absolutely understand their concern about duplication of benefits, I think that is unfounded. There's enough documentation that happens at all levels. And both of the agencies have information sharing agreements. And so if we implement the SBA, there's nothing, there's no obstacles to SBA providing that information to FEMA, to make sure that people are not receiving duplication of benefits. But that's really my primary ask to our federal delegation, is to please remove that rule. Because really that is our biggest obstacle right now. And so really we just need an answer. At this point, and I'll just be very frank, I don't care if it's a no at this point. We just need an answer so that we can move forward with the other programs that are available.
Yep, I was just gonna add, having been in a deputy chief role previously and Christina's role as well, working alongside John Colton and some others here in Spokane and with Luke. If you tune into any of the social media about this, it's pretty common. People really rallied right around the time of the event. The community rallied together. People started to take inventory, and they've been stuck, in their words, in kind of a purgatory limbo state since then. So you can imagine the disillusionment that's going on, and it's kind of disaster psychology, just the drop people are experiencing hitting around the holidays. And now there's some potential as this conversation's come up again. There have been a number of town halls with legislators and county officials in the last couple of weeks, and there's been some really good media reporting on those. And so you can really hear the voice and the frustration level. To Commissioner CUNY's point, and this is reflected in some of the media reports as well, we have a number of constituents living in trailers. And so you can imagine how uncomfortable it is and how difficult and maybe dangerous it is to be living in a trailer and sub-zero temperatures with those insulation levels, let alone the snow and other things that's coming. I did want to add too, and this is more of a forward-looking item, but I'll say first, any advocacy, in my experience with the White House, at the chief of staff level or higher, I think looking at John for a head nod, but would probably be appropriate. If the members can call, great. If the chief of staffs can call, if 3 offices are calling, they may see a little bit more blinking light on this than just one. And John's experience, I think he shared in the past, it took several phone calls between the Biden inauguration and then when a decision was made on the Malden case. I think the message I got back from Intergovernmental Affairs Office in the White House from Mary CUNY's contact, Tom Perez, and his office was, they'll redirect us to FEMA Intergovernmental Affairs. But if we, any advocacy, I guess, with the FEMA administrator, the National Security Council, OMB, all the different kind of chutes and ladders, on the board where this request could be stuck or has to go through before it gets to Oval Office operations and to the president's hand, would be good. And it definitely sounds like it's out of the regional level and it's sitting somewhere in a standard FEMA process as the responses coming back in the letter and the emails from the intergovernmental White House call I was on last week. So just spotlight that for you. One last item on the Malden Act. I think I heard the Senator Cantwell was considering a companion in the Senate. Originally, the mayor of Malden had worked on a shot clock provision, 30 days. You have 30 days, the president has, in the White House, and the agencies have 30 days to respond or it's automatically approved. And that came out of this same kind of delay that happened last time. There's some conversation about rural areas and the state budget and other things that are considered, to the point Katie made about thresholds. With individual assistance, we've been told in the past there is no threshold. It's more of a decision, more of a discretionary decision by the agency and the White House and how their recommendation carries. So I'd be interested in your feedback on that, both on the shot clock piece, but also on, really what it will take to get this unstuck. And to the commissioner's points about the urgency with the weather, that's not unfamiliar. These wildfires tend to happen during fire season, late in the summer. Then we get into these cold weather snaps, and we're having a particularly bad run this year with an Arctic blast. So the urgency is really a key piece of this.
I'll hop in here first just because the Malden Act was mentioned and just want to address that first. So this year, I'm sure some of you know this, when my boss originally introduced the Malden Act back, as a response to the Malden fires, there was a 30-day shot clock provision. This Congress, to make the bill a little bit more bipartisan and not as contentious politically, as well as from a policy perspective, just some feedback that we had gotten, from the Transportation Infrastructure Committee, who has jurisdiction over the bill, is that, putting a shot clock on the president would, send a perverse incentive or provide for a perverse incentive for state governors to act accordingly and shift a lot of the burden onto the federal level. So even though Governor Inslee, was timely in his request, and I think there was just some fear about the federal implications there. And then I will also just speak on the letter as well. I will just say, I can speak for my boss that we're kind of in the same camp as you guys. We're extremely restless and are, at this point, ready to do whatever it takes to get a response. And, I think a lot of us on this call have mentioned the power of unification of our delegation. And so while we do have a letter drafted and ready to say and ready to send with all of these points, about, sub-zero temperatures, temporary housing, underinsured individuals still calling our office for assistance. I'm happy to work with Katie and Megan and just, give a few more days and hopefully have something out the door very quickly. And we would prefer to move forward, with our Senate counterparts at this time. And so, that's on that piece. And I think there was something else about SBA funding. One last point I will make in that regard is that, I'm happy to look into concerns about, SBA assistance. But I will just urge you guys in the meantime that, if if the disaster declaration is denied, the governor still has the opportunity to request a disaster declaration from the SBA administrator, which has a lower threshold for determination. So if you haven't done that already, I would urge you guys to talk to Governor Inslee's office about, having that request ready to go in the case that, the results aren't in our favor in terms of individual assistance.
And then maybe just quickly, I'll just touch on the point that was made about individual assistance and public assistance sort of having different criteria, and that one is more there's more wiggle room, as the state has said a lot, and that's true. There is there's a case to be made. Part of it is we present the information for sure, but still are sort of applied criteria that FEMA has developed to make those decisions and make those recommendations. So that's what I mean in saying that, if thresholds are met, there are still thresholds for both types of assistance, and then then you make your case. And so that's what Governor Inslee did, of course, working closely with all of you, I'm sure. So I just wanted to put that out there. And that's something that I've been exploring very deeply, and that I continue to talk to a lot of folks about. I'm going to be coming over the recess. Would love to meet with a lot of you to understand that a little bit better. But I'm from a rural community. I'm from Idaho. I've spent most of my time in Washington on the east side in these communities that we're talking about. So it's something that feels personal to me, that I want to make sure that communities are getting the assistance they need, and that no one is inherently disadvantaged just because of where they live or how many people are there. So I'm just putting that out there, that this is something that I feel personally motivated to continue to follow. More long term. As for this declaration request that has been made, I definitely agree that we will, like I said, I think right now, like you said, the decision or the holdup right now is with FEMA. This is why I think we should continue to talk to FEMA. As soon as we have any indication that the decision has gone from FEMA to OMB to these other agencies, of course, I'm happy to continue to have to weigh in, to try and get my chief to weigh in, my boss, wherever she's able. Obviously, she's a little busy right now with all the funding conversations, but I'm happy to take this to chief. And if we need to elevate it to her, we can, but definitely going to be following the line here of, where the choice is. And we'll be coordinating with Megan and Hallie. Also, I should just add, our LD is actually going to the White House this Friday. He's leaving. And as soon as we found out, I told him, I have a note for you, take it to everybody. Please go talk to them about this. This is very, very important. So we'll continue to beat the drum and just want to overemphasize that, yes, we want to follow this at every step and make sure that we're weighing in so people know this is important to our delegation.
Yeah, and Oh, I was gonna say, I'll jump in on and make it very brief. Agree with all of that. Like I said, I was really hoping to have something for you guys, and that like we reached out to the White House, the chief did, and to have something immediately. I'll make sure you guys get that. On Malden Act, yes, we are looking to introduce it. We're working to try to get a Republican on our side. You know, we agree with a lot of this. Honestly, from Senator Cantwell's perspective, it was Malden, but then before that, it was actually the 2015 fires where we saw a lot of communities in central Washington that got like completely destroyed, and then there's no individual assistance. So we definitely know that this is not a great process, I guess I can say in the least. There's always challenges in like touching the eligibility and expanding it. And believe me, like I see Chandra's hand raised, so maybe she could probably talk more about how those thresholds are met, because I've tried to explain it to my boss so many times on even what the formula looks like, and it's highly complicated. But I do like looking into the future. I think Malden Act's a great step. And then also where we do want to look further into some of these issues with SBA, and also some of the issues just with how individual assistance for rural communities is dealt with. We were able to get a little bit of a fix, I think back in 2015 or 2016, the agency ended up doing some stuff that made it a little bit better. But as we saw with Malden following the big 2015 fire season, it's still not great. So I know like larger policy discussion, that's something that our boss and, you know, something I've been with her for a while now that we definitely want to work on because we see it.
Thank you. I'm gonna have Chandra go, and then I know we're at time, so if you guys, any of you have to jump off, we understand. I just want to say thank you very much, but hopefully you can stay on for just a little bit longer and we can have Chandra respond.
So I just wanted to clarify, just to make sure you guys understand. We've known since September that we are approved for SBA. We know that. And it's that rule requiring our application to FEMA be denied before we can access the SBA that is tripping us up. So that's really my primary ask, is to get rid of that rule and allow us access to the SBA. The challenge, and I think this is going to be a long-term conversation, but the challenge with how we address wildland fire, especially in small and rural counties, because of the public assistance threshold and the requirement that so much of your infrastructure be impacted, when in rural communities you don't have that much infrastructure to begin with. You know, for example, in our fires, I think we had one county road that was damaged by a bulldozer cutting a fire line, and you know, oh, that was a gravel road to begin with. So not a significant amount of infrastructure to really hit that public assistance threshold. And so we need to find a way to balance the debris removal piece without the public assistance, because that's typically where it sits right now, is under public assistance. And it really is such a key piece to individual recovery. You can't even begin to recover if you're standing there looking at a smoking hole. And so we need to have a better process, a quicker and more flexible, agile process for getting debris clearance assistance to folks, because they can't even begin to recover until we can get that debris off their properties. So, but again, my ask to our federal delegation is to get rid of that SBA rule, please. Thanks.
Yeah, I guess I'll just say, like, I just want to acknowledge, like, those are important questions, important considerations, like, they're things that, again, I'm taking very seriously and looking into. And of course, I know Hallie and Megan are working on this as well. So just want to echo, like, acknowledge the specific request about SBA. I think all three of us will probably start looking into that now. And then longer term, like, definitely these are important questions to be asking to make sure that every community can get the assistance that they need when they need it.
Very good. Luke, I know you joined us a little bit later, but I don't know if there's anything you would like to state from the governor's office perspective?
Yeah, so from the governor's standpoint, you know, we've been with you since day one. And actually, I just got notice a few minutes ago that the governor had a great meeting with Mayor Cooper. So Mayor Cooper is over there in Olympia right now. We made sure to meet with her. So anything you need from us, don't hesitate to reach out. I hope you all feel like we've been there since day one, and we are here and committed to continue to do whatever we need to do to get folks their lives back together stronger. So thanks for the opportunity to be here with you all, and yeah, you know how to reach me.
Thank you. Any other comments? Well, go ahead.
I was just gonna say, again, thank you guys all for having us, and it's good to see you all. If you guys have any questions whatsoever, we're always happy to chat with each of you. And I know that, as Megan, and Katie and I and the governor's office discuss a path forward, we definitely want to keep you guys in the loop, on any outreach efforts that we're doing, and as well as my boss's roundtable that I mentioned previously. Just keep your heads up, and we're gonna keep doing what we can. And you guys have given us a lot to consider on this call, so I appreciate your feedback. And yeah, great to see you.
Yeah, and I just want to say thank you very much for all of you being with us today. I mean, it was so important as we're, like I said, with trying to help our communities move forward, our constituents move forward, which are yours as well, that this is just important for us to all be, knowing, speaking from the same page, I guess. So, and knowing that we just need to help these people get their lives back. So thank you. I know a week's notice is not a lot of time for you guys either. So thank you very much for being able to be here today with us and helping us. And I look forward to what the future brings for these fire victims. Okay. Thank you.
Thank you.
Thank you.
Okay, with that, then we will continue back on our agenda, which we skipped item E, 2E, so Chris Amberson.
Yes, thank you. So, this is a quick one. I have this item is teed up for this afternoon as well, so I wanted to give you a briefing on it. This is an attorney that we are bringing on board to assist with the West Plains Park and Plants Ferry updates. This has to do with the alternative delivery that they are using, and they are, I believe, set to go on that in just a couple of weeks. So we'd like to get this attorney onboarded and hooked up with everybody and up to speed on everything that is going on. This attorney we found is from Pacifica Law Firm, who we've had a very good working relationship with in the past, and is considerably cheaper than the last attorney that we used for alternative delivery projects. So.
Thank you. Do you know what item number that is on today's afternoon agenda?
I'm not off the top of my head, I believe it's the last one on the agenda.
It's last item on the agenda.
Yeah.
Okay, I apologize, I don't have that one in front of me today.
Item O.
Okay.
So this will be an ongoing contract to assist with
This is
any future services or just specific?
No, this is specific to this project.
Okay.
The contract is, so the resolution on the agenda this afternoon is to essentially approve the funding, which is going to be coming out of the parks budget.
Right, okay.
And then we have a contract prepared that we will execute through Larry with Pacifica and this attorney, as well as an appointment of special deputy prosecutor for him as well. And so those are all teed up and ready to go as soon as it is approved.
Thanks. Thank you. Then that's gonna take us to miscellaneous. Any miscellaneous? Commissioner French has two miscellaneous.
I got two. One is just a general update on the Tech Hub. We are working I'm assuming you all know that we made it through the first round. Now there's 30 of us competing for the big prize, which is $70 million per project. But so we are working to put together that application, and this is the part where they say, well, we're looking for a 10% match, what are you in for? And we have, through the private sector, from what I'm told, have made the match with regard to the 7 million. The question now is how do we enhance the match and stuff? So, you know, this is a competitive process, and the more you got on the table, the less, the better your application looks like and stuff. So S3R3 is in for two things: workforce development and training. That's a big factor for manufacturers and aerospace companies as they come into the market. Do they have a workforce available? And so we are working with Mark Madke and his group, but going to be doing workforce development very specifically targeted to advanced manufacturing. And then we are also kicking in marketing dollars in the amount of $250,000 per year for 5 years, which goes to 1.25 million. So combination of the two and stuff, we should be around 1.5 to 1.75 million from S3R3. The airport is going to be kicking in some money as well, but we haven't talked about what that looks like. We will later on this week and next week. And the application is due in February and stuff. And so the question that has been asked of me is, what is the Board of County Commissioners willing to do? And I said, that's a conversation we have not had. And so I'm not looking for a response today, but, you know, is there something that we would want to put in into the kitty to enhance the package? One of the things I was thinking about, and I'll put it out there, is a priority permitting process that would say that any new company coming into the boundary, which is essentially the West Plains PDA, would any new construction would take a priority so that, you know, it's addressing the time is money kind of a question. And so that would be something that's just internal, wouldn't require any financial commitment, but could be perceived as being a pretty good win for a new company and stuff. So throw that out for your consideration. So that's one question. The next question is, on Friday, Mayor Cooper from Medical Lake asked me to provide a letter in support of their funding request. And as you heard Luke Jasmine speak to, she's over there today and tomorrow advocating for $63 million to extend water and sewer up around Silver Lake and Clear Lake, and under the premise that, you know, these homes will be rebuilt, but to rebuild them similar to what was there before doesn't eliminate the risk. And what we need is water line extensions there, provide fire hydrants to mitigate, that urban interface, wildlife interface. And then as long as you're in the ground with water, you might as well be there with sewer. The question she asked of me, and I'm bringing forward to you, is there anything that the county might be willing to do via a match? She's expecting that the state's probably going to look for a local match of around 10%. That's 6.3 million. That's several times more than the City of Medical Lake's annual budget and stuff. So that's not going to be a heavy lift, or that would be a heavy lift for them. Something that is probably going to stand in the way of them getting that grant money. Is there anything that we might be willing to put into the pot? The only thing that I can think of would be if there's any surplus ARP money that we might be able to throw in as part of that match, since it is for sewer and water, and that is eligible expenditure and stuff. And that's a brainstorm, that's not a request. I'm just trying to find out where and what is it that we can do to assist. So those are my two issues for today. Not needing an answer today before noon, but just for your consideration.
So did we know on the Tech Hub that there was a match as we went after that?
Yeah,
Okay.
and we were comfortable that we were gonna be able to hit the match from the private sector. So the private sector, the partners that we have from the private sector side of it, from what I'm being told, has met the match. So the 7 million, from the local level has been met. So
Okay.
what we're looking to do now is enhance the match, because as you know, in a competitive process, if you can enhance the match, it moves you up on the list.
Can you send us like who's already, because you kind of listed it, who's already provided some of that match? Like,
I can try and get that. I have not seen the list of who's in, and for how much, but I can get it.
well, just even what S3R3 you're saying,
Yeah, for S3R3,
was that part of the original match or part of the additional? I mean, that's what I guess.
S3R3 is part of the additional match.
Okay,
We're part of the additional match. We're not part of the original match.
okay.
So I'll try and get that breakdown for you.
Sorry, just trying to think through it, so
No,
I
that's
may have
fine.
more questions for you on
Yeah.
that. So,
Yeah.
and then on the sewer, I guess one of my questions would be, when Liberty Lake Sewer District started, how did they start and how did they get? Because it's almost like, is that what they need to do at the lakes? I mean, we talked about it in the lake, what is that process? And I don't know what that process is, so I don't know if someone,
So in this situation, what Medical Lake is doing is they're extending their sewer service out to Silver and Clear Lake, but it's gonna be part of their sewer system. So they're just paying for pipe. And the same thing for the water. They're extending the water system out there to be able to handle the demand. So it's not a new system, it's expansion of an existing system. I can find out though.
yeah, I just think we don't have an extra $6 million just laying around.
Oh,
So-
when she made the request to me, I choked and sputtered and going, I don't know where we're gonna get that kind of money.
And kind of
stuff,
even
and
based
so-
on the new ARP guidelines, it won't meet that, even if we had it.
Could they, I'm just brainstorming here, but like, would they be eligible, cause eventually they will get, people will pay to be part of the system, but they don't have that money right now.
Right.
But can you get like a low to no interest loan through like
The Public Works.
That was what I was thinking, and then you could pay it back through, eventually through, the user fees, but I don't know, that was just
So
a lot of infrastructure to try and get
And
going.
it's probably timing, because they've got to, these people are rebuilding, gotta do it now.
well, and the other part of it is that my understanding, and is Jeff anywhere around? It's my understanding that the Public Works Trust Fund doesn't have any money in it, that the state has stripped out the funding in that once again. And so they could,
They have reduced some of it, so they didn't take all of it.
they didn't take all of it, but
But
that
it's
would be
still
an
already,
opportunity.
there
That's-
could be a lot of it programmed out,
Yeah.
that's a
That could be a
big
good
ask,
match.
Yeah,
because it's a smaller amount, it's not, they couldn't do 63 million out of it.
Right,
yeah.
but maybe they could leverage some of that as a match to get some state
Yeah.
funds, to get going.
So as
I'll
we're over
mention
there,
that to
we
her.
might wanna talk to Mayor Cooper if you see her,
Yeah.
Yeah,
so.
okay,
Any other miscellaneous?
that's all, no, that's all you can handle, just those two.
Yes, it is, those are like big dollar.
Big dollars, this is a big boy game now.
$63 million miscellaneous.
Yeah,
Nice.
wow.
Well, but the 70 million, I mean, that's coming our way,
It's just a wash.
One quick one, Kyle just let me know that the timber salvage logging operation is starting this week up north on the county-owned property. Vaughan Brothers is doing that, kind of getting in right at the right time before the lumber doesn't have any, the timber doesn't have any more value to it, so his feeling is it'll be pretty much a net neutral impact, the revenues from the timber harvest and the cost to log this. So FYI, Commissioner Kearns, that's in your district, and just wanted to let you know that's getting underway.
Chris?
Yeah, the quick miscellaneous item. This is mostly for informational purposes. This is new policy that Larry signed off on today for use and appointment of outside counsel. This really just kind of formalizes what's already in the law and basically the historical practices of our office. This is effectively what we had been doing. I think there had been a little bit of miscommunication as far as use of outside counsel and the prosecutor's office role when outside counsel is involved. And so this really just kind of clarifies it and brings it all into a written document. So if you have any questions, I'm available to discuss.
So what drove this?
There were some miscommunications on uses of outside counsel and not keeping the prosecutor's office kind of informed. I certainly don't want to impute any intent to anybody. I think it's, we've obviously, there are some new folks at the county, may not be quite as familiar with county government and how county government works and interact and who has what authority to take certain actions. And so this just kind of memorializes it and puts it all in one place.
So is this something that the board has done, or is this something?
No, not at all. Not at all. This is for your information. I just want to make you all aware of it. This is.
Didn't know whether we were.
This will be going out. No, not at all. We'll just be sent, this is across the board. We'll be blasting it out later today to everybody for awareness, but.
I think it's just with the change in department heads over the last several years and change in civil, over the last several years, that it's just.
Wanted to make sure it wasn't us.
Do you guys want this in the county policy handbook manual, or do you want it to live outside? Because I can add it if you want it added into the main manual.
Well, as soon as I send it out, you can take a look and we can talk if there's, I don't know if there's a place that it fits in there or not, but it's probably one that could go either way.
And a board does not need to adopt it, though?
No.
Okay, perfect. So we'll figure that. I just want to make sure we have it living in a space people can find it.
Yeah, no, certainly, yeah, absolutely, yeah.
I think since Larry is the legal counsel for the county, this is his policy that supersedes us because he's our legal counsel. Thank you.
Right, and that is, and for the one that's on the agenda this afternoon, this is kind of the flow, that we would be going, where the board is approving, entering into the contract and approving the funding source, and then the prosecutor's office is executing the contract and negotiating those specific terms with outside counsel, since outside counsel is working for the prosecutor's office.
Because each outside counsel has to be specially deputized.
Correct.
To
Correct.
work
In order to legally appear for and or advise anybody at the county, they have to have a special deputization, and have, the scope of what they are authorized to do included in that, so.
Okay, thank you. Any executive sessions?
Got two.
Yep. I know we have one that is going to be under pending potential litigation. No action is needed. That should include the board, CEO, myself. Anybody else on this, Scott?
I was going to have Randy, but I don't think he's back yet from his appointment.
Okay. And that should be approximately 10 minutes.
Second one would be under the acquisition or lease of real estate, RCW 4230 110-1B. That will be the board, Chris Anderson, myself, Jeff and Morris, and that should be 10 minutes for action.
Okay. So we are going to go into executive session for a total of 20 minutes. No action is anticipated, so at the end of the 20 minutes, we will adjourn for the morning. We will see back for our 2 o'clock, of which I will be zooming in, and so Commissioner Kearns will be leading that for us. So thank you all very much, and it's 10:30, in executive session until 11:40, or 11:50, sorry.